Assalamu alaikum everyone. Today our topic of discussion is very short, that is adrenal or Addisonian crisis. This is basically a continuation of my previous video on adrenal insufficiency. So let's start with the adrenal crisis. It is basically acute symptomatic presentation of adrenal insufficiency. It means that the patient presents acutely or suddenly in the emergency department with adrenal insufficiency, that is reduced cortisol and reduced aldosterone levels. The features of adrenal crisis are almost same as that of adrenal insufficiency. So the clinical presentation is in the emergency department. The patient has hyponatremia. Why hyponatremia? Because of reduced aldosterone. Because of decreased amount of aldosterone, the patient has hyponatremia. This hyponatremia causes fluid loss, and this fluid loss ultimately leads to severe hypotension or reduced blood pressure. When there is severe hypotension or reduced blood pressure, if untreated, it may lead to shock or cardiovascular collapse. So this is the emergency presentation of adrenal crisis. And the other features are hyperkalemia, that is increased amount of potassium in the blood, which is also because of decreased amount of aldosterone, and due to this hyperkalemia, muscle spasticity and muscular cramps may occur. And the other feature is hypoglycemia. This hypoglycemia is because of decreased cortisol levels. As we know that the cortisol is gluconeogenic hormone, but when there is a reduced amount of cortisol, it may lead to hypoglycemia. So the patient may present with faint and syncope in the emergency department because of hypoglycemia, and the nausea, vomiting or diarrhea. These are the GIT features of reduced amount of cortisol and ultimately leads to weight loss of the patient. So these are the features of adrenal or Addisonian crisis. Any disease or any surgery of bilateral adrenalectomy or infections, these are the various triggering factors of this Addisonian crisis. Now come to the management of Addisonian crisis. The first step is to replace the fluids. The fluids which are depleted in this Addisonian crisis should be replaced first. Maintain the IV line and give the normal saline to the patient in order to correct the blood pressure of the patient. In order to normalize the blood pressure and to normalize the pulse, give the normal saline to the patient, and also maintain the normal sodium levels. If the sodium levels of the patients are below 125 nanomoles per liter, this is very reduced or very severe hyponatremia. So give the patient sodium very slowly. But if you give the patient, but remember, does not give the patient 10 nanomoles, greater than 10 nanomoles per liter sodium per day. If you give the sodium more than this amount, it ultimately leads to demyelination of brain tissues. So do not give the sodium. Remember, do not give the sodium in very high amounts. The glucocorticoids, give the patient IV hydrocortisone, 100 mg IV hydrocortisone for initial 24 hours, and then convert it into intramuscular hydrocortisone, 50 to 100 mg intramuscular hydrocortisone for 4 times daily until the patient gets stable. When the patient gets stable, shift or convert this intramuscular hydrocortisone into oral hydrocortisone in order to replace the glucocorticoids or the cortisol levels. Then correct the other metabolites. Hypoglycemia because of reduced glucose, give the patient IV 10% dextrose, and correct the hyperkalemia because of hypoaldosteronism, that is reduced aldosterone. Hyperkalemia may develop, and correct this. We will discuss the hyperkalemia management in detail in the next videos of electrolyte disorders, but here remember, hyperkalemia is treated with calcium gluconate and insulin. We will discuss in detail about the hyperkalemia in the electrolyte disorders. The last step is to manage the cause accordingly. The pathology, to find out the pathology, where it is in the pituitary gland or it is in the pathology is in the adrenal gland, and manage the cause accordingly. So it is all about the Addisonian crisis. Thank you so much for watching this video.